Welcome everyone to today's lesson from Medical Coding by Jen. We're going to talk about a concept that plays a big role in healthcare, medical necessity. You might have heard this term before, but what does it really mean? Why is it important? And how does it affect people's lives? We'll explore all of these questions and more, breaking it down so it's easy for everyone to understand. Thank you for watching. I hope this information is helpful. I like to help others pass their medical coding certification exams from the exam point of view. Remember, for more helpful information, visit my website at medicalcodingbyjen.com. Let's get started, and remember to take notes so that we can transfer them later to our exam manuals. What is medical necessity? Medical necessity refers to whether a particular healthcare service or procedure is appropriate and necessary for a given patient's condition. Simply put, it's about ensuring that the care provided is the best option to treat the patient effectively without going overboard. Medical necessity means that the treatment or service is required for the patient's health based on their specific medical needs and not just because it's available. For example, if someone has a broken arm, a medically necessary treatment might be getting an X-ray and a cast. It wouldn't be medically necessary to do a full body scan or an unrelated surgery. What determines medical necessity? Several factors help determine whether a service or procedure is medically necessary. Doctors and healthcare providers look at the patient's medical history, symptoms, and the results of any tests or exams. They also consider what the standard treatment options are for the patient's condition. Additionally, insurance companies, including government programs like Medicare, have guidelines to help decide what counts as medically necessary. These guidelines help ensure that the treatment is reasonable and necessary for the patient's condition. Providers use these guidelines alongside their professional judgment to decide the most appropriate care for the patient. For instance, if someone comes in with chest pain, a doctor might determine that a stress test is medically necessary to rule out serious heart problems. How does medical necessity affect people's lives? Medical necessity has a significant impact on patients' lives. It helps ensure that patients receive the care they need without unnecessary tests or treatments that could be costly, invasive, or risky. By focusing on what is truly necessary, healthcare providers can offer effective treatment that improves patients' health and well-being. However, if a service is deemed not medically necessary, it might not be covered by insurance. This means patients could end up paying out of pocket, which can be a financial burden. Understanding what is considered medically necessary helps patients prepare for their healthcare costs and make informed decisions about their treatment options. What interventions are considered medically necessary? Interventions that are considered medically necessary vary depending on the patient's condition. These can include diagnostic tests such as blood tests, X-rays, or MRIs used to determine the cause of symptoms. Surgical procedures needed to treat or correct a medical issue like removing a tumor or repairing a broken bone. Therapies such as physical therapy for recovery after an injury or surgery, or speech therapy for language difficulties. Medications prescribed to manage or cure illnesses like antibiotics for infections or insulin for diabetes. Preventive care, screenings, and vaccinations to prevent illness or detect diseases early. These interventions are recommended based on the best available evidence and guidelines, ensuring that patients receive the most appropriate and effective care. Conclusion: understanding medical necessity is key to understanding how healthcare decisions are made. It helps make sure that patients get the right care at the right time, which can lead to better health outcomes and avoid unnecessary costs or procedures. By focusing on what's necessary, healthcare providers can provide safe, effective, and efficient care. Thank you for joining today's lesson from Medical Coding by Jen. I hope you now have a clear understanding of what medical necessity means and why it's so important in healthcare. For more helpful information, don't forget to visit my website at medicalcodingbyjen.com. If you found this lesson helpful, please like, comment, and share. Stay tuned for more insights into healthcare topics, and take care.